Since the beginning of the year, we've had 1,232 people, 1,232 people who've died of COVID-related issues, who had, this is the important issue, who had less than the full vaccinations that were available to them. That's a critical issue. Having your full dose of vaccinations that are available to you does make a difference. What we do know now is that getting fully vaccinated, whatever number of vaccinations you are eligible to get, does make a difference. The vaccinations are not necessarily stopping transmission. If you haven't had your full doses, and most of the population know that you can have up to 3 doses, and then possibly 4 or even more. But if you've had 2, for example, or 1, and you haven't had your full 3, putting it bluntly, you're crazy. You should go and get them. I think there are some in the community who are just very busy. There are others in the community who think the pandemic's over. On both of those counts, they're wrong. I mean, I know I have friends who've said to me that they're fully dosed, and when I asked the question, they've had 2 doses of vaccine. And as the health minister, I quickly tell them, go and get your 3rd dose. It's certainly it's an overconfidence that the pandemic has come and gone. It hasn't. It's well and truly here. In addition to those basic measures, and for a variety of reasons, some people haven't done what they need to do. And the message here is go and get the 3rd dose. Go and get the 4th dose if you're eligible. And if at some point the Federal Government Advisory Board say get a 5th dose.
So we have started a new wave. We need to make it clear that previously we did tell you to get 2 doses and that would provide protection against COVID. But the virus has changed. So now with Omicron, the evidence is clear that we need 3, or in some cases 4, doses to provide the best protection against getting very sick. But they're not so good at protecting us getting infected in the first place. So we need to act now to slow the spread of the virus in the community. And I'm confident that as a community we can take those actions to slow the spread, as well as the individual actions of getting vaccinated, which fundamentally protects ourselves. This is important because when we have levels of sickness and absenteeism, it impacts on the broad community in terms of its access to goods and services, as we saw in January. So we all have a part to play, and by taking these simple steps, we can really slow the spread. And as I said, vaccination is key for that individual protection. But this is going to be a journey. It's actually a positive story that we have such good vaccines. Now, whilst for many protected by the vaccine, you don't need to be hospitalised or you won't die, or won't likely die. You know, many of your friends, it's a little bit of potluck, you know, even that fit, healthy triathlete can be bedridden for a week with it. So my message to everyone is disregard anything we said about 2 doses. It's 3 doses or more.